here and see. I'll start. I hope everyone is able to see. Everything is perfectly fine with everyone. I shall be starting with the recall session of ENT. Fine. With this note, I shall be starting with the recall session of ENT. I shall be telling you that one particular thing I want to tell to all the students right now before starting with this particular session. First of all, whatever has been done has been done. Right now, relax, spend time with your parents, families, and everyone. Fine. Cheers to the hard work that you had put. Sorry for the inconvenience caused. I hope everything is fine. I hope everything is fine. Yeah, so I shall be starting with this particular recall session, and with this hope that everything is fine. I hope everything is fine. Just yes. So let us see the recall session. Let us see the recall questions, and my sincere apologies for any technical problem that had occurred. First question that we shall be discussing is that yes, one more thing before starting with this session. This is totally a recall based session from whatever students who reported me the questions. If there is any discrepancy in the question, you can message me on Instagram or the media platforms. Fine. So first question that I shall be seeing is a 48-year patient presented with hearing loss in the right ear, and on examination tympanic membrane was dull and a B type of tympanogram was seen. Patient also presented with neck swelling or neck nodes. Fine. What shall be the ideal treatment? What shall be the ideal treatment? So, if I consider this particular question, see, first of all, this person is an adult patient. I had heard that many of the students were having a doubt, sir, it can be a case of adenoid, but it is not a case of adenoid, because if they were to give a case of adenoid, they would have mentioned, first of all, a child preferably. Fine. Secondly, they could have given features of adenoid faces also. They could have given features of adenoid faces also. Fine. This is an adult patient that they are talking about. This is an adult patient that they are talking about with a neck swelling. Some said that there was mentioned that there was a swelling in the posterior triangle. So whatever it is, whenever there is a neck swelling and neck node, most common presentation of neck swelling or neck node, it is the disease particularly that is nasopharyngeal carcinoma. Fine. Nasopharyngeal carcinoma, most common presentation is neck swelling or neck nodes. Secondly, because the problem is in the nasopharynx, eustachian tube blockage will occur, which will ultimately lead to serous otitis media, giving a B type of tympanogram. Fine. And the tympanic membrane was dull. So basically, this is a case of nasopharyngeal carcinoma. And if you know the ideal treatment for nasopharyngeal carcinoma, please mark my words, the ideal treatment for nasopharyngeal carcinoma is chemoradiation, which is the first option, followed by radiotherapy. It is a highly radiosensitive tumor, followed by radiotherapy. So the best correct option among all these options is option number B, that is radiotherapy. You cannot go for grommet insertion or steroids. Grommet is totally out of option because it is adult patient with nasopharyngeal carcinoma. What will grommet help? Nothing. No wait and watch or not neck dissection. The main treatment, the first treatment is chemoradiation. If that is not in the option, then radiotherapy. Now coming to the next question. Next question is basically a case of your very famous Hallman-Miller sign. If you could appreciate, a CT picture was given, hopefully, and they had asked the diagnosis. I have got this particular thing from radiology and ENT combined. There were two questions from juvenile nasopharyngeal angiofibroma. If it is fine, well and good. If not, only one question received. Totally up to you. What is the given CT picture? Please see. If you see this particular side, this is right side, this is left side. Left side is normal. Left side is normal. Maxillary sinus is also properly sized normal. Fine. On the other side, that is the right side, you can see that the tumor is pushing the walls of maxillary sinus anteriorly. Tumor is pushing the walls of maxillary sinus anteriorly. Basically, the posterior wall of maxillary sinus is pushed anteriorly. And this is a characteristic Hallman-Miller sign, also called as antral sign, a characteristic feature of juvenile nasopharyngeal angiofibroma. You might be knowing, they say 14-year-old boy with profuse uncontrollable epistaxis. That is the case. So this is a case of juvenile nasopharyngeal angiofibroma. The CT picture is basically the Hallman-Miller sign. If you have any doubt, if there is any controversy, please, just type it on YouTube right now. I will clear it out. Fine. These two are the first two questions that we have discussed till now. Fine. Coming to the third question that I have most probably received, that there was a patient with they had given with chronic suppurative otitis media. They had given some cerebral features like seizures, headache, vomiting. CT picture was given like this. See, a ring was shown in particularly the temporal lobe. A ring-like structure was shown in the temporal lobe. Bache, this is frontal. Occipital is behind. This is temporal and this is parietal. Temporal lobe, they are showing you a ring-like structure. What is your diagnosis? What is the complication that we are talking about right now? This is basically a temporal lobe abscess. You cannot go for meningitis or extradural abscess. It is very characteristic of particularly temporal lobe abscess. Fine. This is a ring-like structure seen on this particular CT scan. This is the temporal lobe abscess. That is the option I will be going for. If you have any doubt, you can just notify it. Fine. Going to the next question. Yes, going to this particular next question. Next question was that a patient presents to ENT OPD with hearing loss. It was found that the rhinitis was positive in the left ear. It was positive in left ear. Then it was negative in the right ear. Rhinitis was positive in left. Fine. Negative in right ear. Fine. Weber was lateralized to the left. See, bache, whenever these type of questions come, I'll tell you the easiest way is first check Weber. Weber is the most accurate one. Weber lateralized to left. Weber is going to left. We know by tricks or mnemonics, if Weber is going towards the left side, what does this particular thing signify? Either it can be left side conductive hearing loss, or it can be right side sensory neural hearing loss. These two can be the options, either left side conductive hearing loss or right side sensory neural hearing loss. But if I also further read the question, it was also shown that the absolute bone conduction test was reduced towards the right side. ABC reduced to right side. That means more going towards sensory neural hearing loss of the right ear. Now let me check the rhinitis test. Rhinitis was positive in left and negative in right. Sir, if it is negative in right, how come sensory neural hearing loss? Arey bachche, there is a very known fact. You might have written in your notes also. Check your notes. Whenever we say Rene is negative, but Weber is lateralized towards what? The normal ear. What is the thing that we are thinking about? What is the thing that we are thinking about? It is a false negative Rene thing. And here the diagnosis that we have to go for is right side sensory neural hearing loss. See, it is more going towards right sided sensory neural hearing loss. This is the most appropriate diagnosis. Again, if there is a controversy in this particular question, sir, some students were saying that absolute bone conduction test was not mentioned. Fine, you can check it. If someone says, sir, no, Rene was mentioned differently, again we can check, but the basic concept is same. First of all, check for Weber test. Weber test is going towards left ear. That means either it can be left conductive hearing loss or right-sided sensory neural hearing loss. ABC is reduced towards the right, going towards right-sided sensory neural hearing loss. It can be a false negative Rene. Fine. So it is a right-sided sensory neural hearing loss. Fine. Going to the next question, very famous known question is this particular thing, and that is what? Very famous for CSF rhinorrhea. Whenever there is a traumatic CSF rhinorrhea, when that CSF along with tinge of blood comes out, you see a very famous target sign. This is a very famous diagnostic image of target sign. You cannot mark beta 2 transferrin test. Beta 2 transferrin test is a biochemical test, bache. It is the biochemical investigation of choice. Remember, biochemical investigation of choice is beta 2 transferrin test. Similarly, what is the radiological investigation of choice? Radiological investigation of choice is CT scan. Fine. Like one student is saying, sir, is question it was not like this. The only thing mentioned was renin negative in left ear. If renin negative in left ear, that is the only thing that is mentioned, then just renin negative, it will be left-sided conductive hearing loss. But we have to see Rene, Weber, and ABC all three. What I am telling you is, if Weber was also mentioned, first check Weber. Where is Weber going? Then make the diagnosis. That is the thing I want to tell. First, always check for Weber. Where is Weber going? Fine. After Weber, check for Rene. That is, whenever I particularly solve this question, I always say, first check for Weber, then you make your diagnosis. Fine. Questions, it can be different, totally understood. Fine. This was a target sign that you had to mark. Fine. Coming to the next question. Fine. All three were mentioned. One more student was saying. Again, I have clarified it. Fine. A child presents with a previous history of intubation to the OPD with shortness of breath. Maybe some days or weeks later, he comes to the with shortness of breath. A radiological image was given. A radiological image was given, and this was the radiological image given. Bache, we should know, it is a known question, bache, that this is a characteristic image of the Steeple sign. Steeple sign is seen in which disease? It is seen in croup. Croup is also called as laryngotracheobronchitis. Croup, laryngotracheobronchitis. Steeple sign of laryngotracheobronchitis in short was asked. If you don't want to read the question also, it's fine. It is a very famous sign, that is Steeple sign of laryngotracheobronchitis. Fine. Fine. Like once, bache, if for this particular question, if you are saying that nothing was mentioned, only Rene was mentioned, then perfectly fine. You can mark only with Rene. But if other things were mentioned, you have to check other things like Weber and absolute bone conduction test also. Fine. Now comes this particular question. Some students are saying type 3, some students are saying type 4. I will clarify it properly. That's why I have given you a labeled picture. Maybe this is not the exact image that you would have got, but somewhat related image you would have got. Fine. Somewhat related image you would have got. Fine. I have labeled it properly. Basically, I've got one labeled image. So basically, what is this? Supposedly, this is the temporalis fascia graft. Temporalis fascia graft would have been either kept over the complete stapes, suprastructure of stapes, or this may be the option number 1, let's say. Or some students are saying, no sir, stapes was totally not there, only foot plate of stapes or over window was there, so I would have kept the graft over here. That is option number 2. If graft was kept over complete stapes, over the suprastructure of stapes, then you have to go for type 3 tympanoplasty, bache. If the graft was kept over just the foot plate of stapes, only a small foot plate was mentioned, that is option number 2. Fine. Fine. That was option number 2. If the graft was kept over the foot plate of stapes, if the graft was kept at the foot plate of stapes or directly over the oval window, you should go for type 4 tympanoplasty. Fine. If we are keeping over the complete stapes, then you have to go for type 3 tympanoplasty. If it was kept over only the foot plate of stapes, अच्छा, like one student is saying stapes was totally not there. बच्चे अगर stapes नहीं था, if stapes was not there, then you have to mark type 4 tympanoplasty. I am clarifying to all groups of students. I have received, some are saying stapes was there, some are saying stapes was absolutely absent. If proper complete stapes was there, then you have to go for type 3 tympanoplasty. If stapes was absent, go for type 4 tympanoplasty. Fine. I am considering mostly students have said that stapes was absent. Stapes was not there. Maybe only foot plate was there or only oval window was there. Better go for type 4 tympanoplasty. Again, if some people are saying no sir, stapes was there, go for type 3 tympanoplasty. Totally up to you, bache. You have seen the image. Don't go for like he said that or I said that what we are saying. Fine. I am totally going upon the recall of most of the students. Fine. So go with what you have seen. Fine. Type 3, type 4, both I have clarified. Fine. Yes. Now this particular image, which of the following part of the basically the nasal part has been shown in this particular CT scan? Maybe this was not the exact CT scan. Obviously, again, the CT scan picture you have seen. Mostly student had said that these four were the options. These four were the options. I believe if such a CT scan was given to you, I believe if such a CT scan was given to you, I believe mostly that the option you should have gone for is osteomeatal complex. Maybe they would have labeled somewhere here. Maybe, fine. Maybe they would have shown somewhere here, somewhere here, somewhere here. Then you have to go for osteomeatal complex. Bache, now one more thing. Some students are saying, yes, sir, there was one option, ethmoid sinus, in this particular question. I don't know. I have not received an option as ethmoid sinus till now. I had received these four options. I believe if such CT scan image was given and something here they would have labeled, then it would have been osteomeatal complex that you have to mark. They won't give you, a CT scan picture to mark your nasal valve or columella. If they give you a CT scan picture, mostly they will ask either for the sinus or the best thing is osteomeatal complex. You might be knowing what is OMC. OMC is a common drainage pathway for most of the sinus, your maxillary sinus, your frontal sinus, and anterior ethmoid sinus. For the recall what I have received, I shall be going it for basically the option that I will be going for is the osteomeatal complex. If arrow at the top of maxillary sinus, people are saying that there was arrow at the top of maxillary sinus, then again I would have preferred to go for OMC, which is osteomeatal complex. If these four were the options, because OMC is a hot topic, bache. I don't feel so that columella nasal valve will be asked from a CT scan picture. OMC, so you can check my notes also. Osteomeatal complex, so I always emphasize on it is a very important structure. It is a common drainage pathway for most of the sinuses. Fine, I'll go for osteomeatal complex if such sort of image was asked. Fine. Going to the next question. Yes. A child presents with a history of inhalation of a foreign body, nut, groundnut, cashew, whatever, I don't care. On auscultation, a audible thud was appreciated. What is the location of foreign body? If this was the question, let me clarify. First of all, what is thud? बच्चे basically thud होता क्या? Try to understand. Supposedly this is trachea. ठीक है? If there is a foreign body in the trachea, during inspiration and expiration, basically what happens during inspiration and expiration, that foreign body will be creating an obstruction at the level of trachea, and it is a auscultatory finding, that is audible thud. Thud is basically appreciated whenever there is foreign body, at the level of trachea. Remember that thud is always appreciated. T for thud, T for trachea. I always say T for thud, T for trachea. Fine. So whenever there is foreign body at the level of trachea, there will be thud. Fine. I hope this particular portion or this particular question is also clear. Fine. Now, very, very famous known question. I hope we would not have made a mistake in this particular question, God forbid. Patient they had given that had presented with nasal obstruction and merciful anosmia word was given. Greenish crust was also mentioned. Something greenish crust was also mentioned. Fine. What shall be your diagnosis? In the last question, someone Dr. Zishan is saying that there was one option bronchus, but I'll still go for trachea. Fine. Yes. So in this particular question, what is your diagnosis? Known question बच्चे, merciful anosmia. और क्या चाहिए? Merciful तो word सुनते ही एक ही दिमाग में चीज आते हैं. What is the diagnosis that we have to make? That is atrophic rhinitis. Atrophic rhinitis presents with person presents with merciful anosmia. What is merciful anosmia? Patient cannot appreciate any smell, and everyone around, the relatives, friends, the doctor, everyone will say that the patient is producing a very foul breath, foul smelling discharge from nose. Greenish crust was also mentioned. What more do we want to mark atrophic rhinitis? Some students are saying, okay sir, can it be rhinoscleroma? But let me clarify this doubt also. If woody hard nose word was mentioned, either woody nose or hard nose, if this word was there in the question, the diagnosis will be rhinoscleroma. If this thing was not there in your question, woody or hard nose, anything like this was not mentioned, diagnosis is atrophic rhinitis. From most of the students what I have received, they said woody word or hard word was not mentioned, so I shall be going for atrophic rhinitis. I am clarifying the doubt for both groups of students. I hope this question is clear. Fine. Going to the next question. Fine. A child presented with respiratory distress, okay, cough, inability to speak after consumption of a fruit. I don't know, some are saying custard apple, orange, whatever. Fine. What shall be the initial treatment? Now, let me clarify, because it is a controversial thing, for which, most of the students are basically asking, sir, what should have been the correct option? Sir, the best correct option is that immediately save the life of the child through Heimlich maneuver. If they have asked initial treatment, initial management also, if they would have asked, again go for Heimlich maneuver. Some are saying, sir, X-ray was in the option. First, we should diagnose and go for X-ray. बच्चे नहीं. सबसे पहले, if I wait till the X-ray comes, till I see it in the X-ray, chances of the survival of the child are lost. Immediately, we know by the history that there is a foreign body consumption. Child is in respiratory distress. That means the foreign body is in the respiratory pathway. I will first try and go for the Heimlich maneuver based on the options that are given. Some students also mentioned that, sir, CPR was in the option. If CPR was in the option, please specify. I want to ask, I will wait for this particular question only, if CPR was mentioned in the option or not. Some students are saying that CPR was also mentioned in the option. Let me clarify this, bache. If they had gone for this particular, question, in this particular question, if cyanosis or, skin discoloration or cyanotic features they have mentioned, I want to ask, in that particular question, did they mention something like cyanosis, child is landing up into cyanosis, bluish discoloration? I want to ask, if such thing was also mentioned, then CPR can also be the correct option. Now it totally depends what the examiner, was thinking at that particular point, and how that examiner had decided the question. Sir, if cyanotic features were mentioned, then CPR also can be a good correct option. Let me clarify this doubt. That's why I taken one day particularly to clarify and check from all the students. And if cyanosis or these things were not mentioned, then best treatment is Heimlich maneuver. Fine. If bluish discoloration or cyanosis things were mentioned, CPR also can be the option. But right now, what I have seen or received, such sort of features were not mentioned, then Heimlich maneuver, I think so, shall be the best correct option. Again, but it totally depends upon the examiner. The mindset of the examiner who was preparing the question might have been thinking, okay, CPR can be done. Some would say, can Heimlich can be done. Let me specify, if bluish discoloration or cyanotic features were also there, CPR can also be the correct option. Why? Because right now, revival or survival of the child is at stake. Fine. But if these four were the options and CPR was not in the option, I'll go for Heimlich. Fine. Now I have a doubt. let me ask from you, was there any question from pure tone audiometry? Some students are saying that there was a question on PTA pure tone audiometry. If like some students were saying that there was something related to conductive hearing loss, PTA image given, something like that. If given, fine, I hope so you would have marked it, because you can check your 25 most important question discussion. I had emphasized on PTA a lot. If that was there, I mean, this pure tone audiometry question was there, I hope you would have marked it correctly. Conductive hearing loss, maybe they would have given an audiogram where frequency was here, decibel intensity was here. Fine. If decibel intensity was here on the y-axis, frequency on the x-axis, they would have given 25 here, and two lines would have been there, one here and one over just below 25. I mean, the gap would have been high. AB gap would have been high. This is a bone conduction line. Fine. And this is the air conduction line. AB gap would have been high. If there was a pure tone audiometry graph, then I hope so you would have answered conductive hearing loss. Image, what type of image? A pure tone audiometry image was given, or you are asking that B type of tympanogram of impedance audiometry, that flat curve was given. See, there can be two things. Either a pure tone audiometry was given like this, a pure tone audiometry image, or the second option is a tympanogram would have been given, where they would have shown you a flat curve, B-line flat curve. From most of the students, what I have received, they said, sir, a pure tone audiometry image came. If a pure tone audiometry image came, then obviously you would have marked this particular conductive hearing loss. Both were mentioned. If two images were given, then what I feel so, acha, if two images were given, then what I feel so, that B type of tympanogram would have been given and a PTA would have been given, and still your answer would have been conductive hearing loss, if both the images were given. If there were two images, I'm 100% sure, then a B type of tympanogram like this would have been given, and a pure tone audiometry image like this would have been given, and the diagnosis will still go towards conductive hearing loss if both the images were given. I am specifying and clarifying if this particular thing was asked. Fine. Now, one more doubt question. Was there any question I am suspecting regarding pulsatile tinnitus? You know, something tinnitus would have been mentioned, and a, a tumor or a growth was given in middle ear. Maybe image would have been added, if added. Was there any question like this? I'm asking from all of you who are listening. Was there any question? Some students have said, that's why I'm clarifying it right now. Something regarding pulsatile tinnitus, a tumor or a growth in middle ear, something like that. If that was the case, I have heard from some of the students that there was a question like this. Then I hope so there have been a question from glomus tumor also, regarding maybe a female patient or a male patient came with tinnitus, maybe pulsatile tinnitus. If that was not in the question or options, perfectly fine. There was no glomus tumor. If that was there in your exam, fine, you can consider it. And lastly, one more doubt I had. Some students were saying that there was one more question on your teardrop sign. But your teardrop sign, if they would have asked maybe with a CT scan picture, if there was a teardrop sign asked, I hope so a CT scan picture would have been given to you. Obviously, we know where is teardrop sign seen. Teardrop sign is a classical thing of orbital fracture. Basically. Fine. At the base of the orbit or the top of the maxilla, you see a teardrop that is basically seen in orbital fracture. And if glomus tumor was given, then glomus tumor would have been given maybe with a female patient. Decreased hearing would have been there. They would have mentioned something like a reddish mass behind tympanic membrane. Fine. And tinnitus also. Then glomus tumor. And if there was a CT scan picture with the teardrop sign, like this teardrop sign, it is a feature of orbital fracture. You would have made the diagnosis. I know that you would have made it correctly. Fine. Still, bache, if we have any doubt, you just message me on my Instagram ID ent_by_dr.shubham. Still, batches, students feel that I want to discuss something personally. You can discuss if any doubt in any particular question. ent_by_dr.shubham. Ent by Dr. Shubham. With this note, I hope you will make through, and my best wishes to all. Let us pray together and just have that hope that we will make through this particular exam. Spend time with your family, friends, and more importantly, your parents. My best wishes. Thank you so much. Jai Hind. Take care.